Hey there, YouTube fam. Today we're diving into some fascinating news that might just keep your oncologist away. Regular aspirin use. A recent study suggests that popping a few aspirins could lower the risk of colorectal cancer, especially for those with less than ideal lifestyles. So let's break it down. What's the buzz about? Colorectal cancer is a big deal, folks. It's the second leading cause of cancer death worldwide and is expected to cause over 52,500 deaths in the US alone this year. More than 153,000 Americans were diagnosed with it in 2023, and alarmingly, it's becoming more common in people under 55. Yep, the numbers have more than doubled for this age group over the past decade. The culprits behind colorectal cancer. Now, what's causing this spike? Genetics play a role, but lifestyle factors are major players too. Think unhealthy diets, lack of exercise, alcohol consumption, smoking, and high body mass index, BMI. These factors can significantly up your risk of developing colorectal cancer. Aspirin to the rescue? Doctors have often recommended low-dose aspirin to reduce the risk of colon cancer. However, the advice has been a bit of a roller coaster. In 2016, the U.S. Preventive Services Task Force endorsed it, but they reversed course in 2022 due to concerns about bleeding and gastrointestinal issues. So what gives? The latest study, published in JAMA Oncology, took a closer look at who might actually benefit from regular aspirin use, despite the risks. The study DEET's researchers analyzed data from over 107,655 people involved in the Nurses' Health Study and the Health Professionals Follow-Up Study. Most participants were white, so further research with more diverse groups is needed. Participants were tracked for at least a decade. Their lifestyles were monitored, including BMI, alcohol intake, diet, smoking habits, and exercise levels. Regular aspirin use was defined as taking 2 or more regular strength aspirin, or 6 or more low-dose aspirin per week. The findings. Here's the kicker. Regular aspirin users had an 18% lower risk of developing colorectal cancer compared to non-users. But the real winners were those with unhealthy lifestyles. Smokers and those with a BMI over 25 saw the most significant benefits. Dr. Daniel Sikavi, the study's lead author, explains, aspirin can proportionally lower the markedly elevated risk in those with multiple risk factors for colorectal cancer. For those leading healthier lifestyles, the benefit was less pronounced but still evident. Why aspirin works? The exact reason aspirin helps isn't clear, but previous research suggests it might inhibit pro-inflammatory signals that lead to cancer. However, the study wasn't a randomized clinical trial, so while the findings are promising, they're not conclusive. More research is needed. Should you start taking aspirin? Before you rush to the pharmacy, let's get some expert advice. Dr. Christina Annunziata from the American Cancer Society reminds us that lifestyle changes like maintaining a healthy weight, eating well, and drinking less can also reduce cancer risk. Dr. Raymond Dubois of the Hollings Cancer Center notes that this research might help explain why some studies show benefits of aspirin while others don't. Dr. Jennifer Davids, a colon and rectal surgery chief, urges caution. While the study is promising, aspirin isn't without risks, and it's crucial to talk to your doctor first. The bottom line. Aspirin could be a simple and effective way to lower colorectal cancer risk, especially for those with higher risk factors. But remember, it's not a magic bullet. Healthy eating, exercise, avoiding smoking, and minimizing alcohol use are still for reducing cancer risk and leading a healthy lifestyle. So, there you have it. Regular aspirin use might just be a game changer for preventing colorectal cancer. But always consult with your healthcare provider before starting any new medication. Stay healthy, stay informed, and as always, take care. Don't forget to like, subscribe, and hit that bell icon for more health updates. See you in the next video.